Hello, I'm Jawad Husain. I'm the Executive Medical Director at East Lancs. Firstly, I'll give an update on how things are in regards to COVID. There is definitely an improvement in the reduction of community transmission, and we are seeing rates which are far, far lower than what historically has been. And that definitely is a positive move, because as a result of that, the number of admissions to the hospital has also reduced. And at one stage, as you know, we had people in intensive care because of COVID. That thankfully isn't the case. And not only the number of patients being admitted with COVID has reduced, so has been the nosocomial transmission within the healthcare setting. And also, there has been a reduction in the number of healthcare workers who have gone off sick with COVID. So, as a consequence of these four factors, in keeping with the guidance that came out from the regional infection prevention and control team, we have taken a decision to remove the mandatory mask wearing in the organization, and that came into effect from Friday, the 2nd of September. The situation gets reviewed constantly, day by day and week by week. And if any of the factors, which is increased transmission in the community, increased number of patients with COVID in the hospital, increased sickness of staff, or increase in the nosocomial transmission, will result in reintroducing mandatory mask wearing. So we, working with our IPC team, closely monitor the situation. The other principles of IPC, however, should be followed, which is hand hygiene, and making sure that we follow all the principles when attending to the patients in regards to those. And that will prevent not only COVID, but any other transmissible disease which can happen if we don't follow the IPC principles. So talking about other transmissible disease, flu is the one. We've started with the autumn season, and we know that come September and October, there is a rise in the incidence of flu. But one important thing which will curtail the transmission of flu virus is the COVID vaccine. The program has started and is offering all the vulnerable individuals are eligible. One can have it at their local pharmacy or at designated sites which have been put up by GPs and the surgeries. So please ensure that you do get your vaccine on time. Moving on, in regards to particularly ELHT, we have a festival of inclusion from the week beginning 26th of September. Now, inclusion is very important for any organization like ours who deliver on the healthcare, but for that matter, any organization that works and deals with the citizens and communities. It must be ingrained in our DNA, because we do believe on inclusion and equality, and being a healthcare organization, that is very close to our heart. There are a number of podcasts and talks and presentations that will be taking place. We would encourage you to listen to the podcasts. On this, I will end my update for this week. In a couple of weeks' time, I will be back with more updates. And like I did a couple of weeks ago, where I had taken you through to our discharge lounge and how it provides an excellent service to our patients, their loved ones, and the community, I'll be going to another clinical area and will take you through the journey of how patients and staff experience when they are in that particular area. Look after yourself and your loved ones. Bye for now.